The reduction in additional liner and, in refinement translate in improved patient compliance because the patient, after 12 months, they start to get tired of it. So the compliance start to decrease. Improve patient satisfaction. They're just happy to be done faster than all their friends, right? And increase practice profitability. So I'm going to show you a few cases very quick where I can do an analysis of the profitability per case, per fee, per visit fee. So this is a pre-treatment done on Chen, 29 years old. He has severe deep bite and severe lower crowding, was treated in 9 months with no refinement. It's not a simple case, as you know. He has a deep bite, a 57-degree rotation of the lower arch. You can see what we incorporated in our clean check is exactly what we saw in our final alignment. So it's like almost 100% mirror of what we were planning. And so in this particular patient, the total fee per visit was 1,190 with some simple seven visit included debought. So very nice profitability for a case with 7 visits. Ramsey is 53 years old. He has a severe deep bite with severe lower wear. He had to replace his upper crown, so we had to create a better clearance for the dentist to rebuild those crowns. So we treated with Invisalign and orthopulse, and the patient was finished in 11 months with 30 upper and 40 lower aligner with no refinement needed. You can see we level the curvus P, we're aligning the lower teeth, and the patient is super happy. And this is the final results, and the profitability for total fee per visit was at $1,352. So very significant amount compared to if he had 2 or 3 or 4 more visits, the total fee per visit would have decreased significantly. So it's important to decrease the visit. Another pretty complicated case is Kunal. He's 28 years old. He has a deep bite, severe detour teeth. So those are complicated cases to treat with aligner therapy, just because we know the challenge in the plastic of torquing the teeth and intruding the teeth. So those are both very complicated movement that had to happen in the same teeth in the same patient. And also, we wanted to, the severe lower crowding, so and the severe curvus P. So we anticipated a structural with treatment plan destruction of lower right 2, which, as you understand, is going to make it very hard for us to take the root to lower right 1 and intrude at the same time. So they're all very complicated movement to do at the same time, and we're able to accomplish that without additional refinement. So the patient was treated in 12 months with 48 upper, 53 lower aligner, and with a 5 to 7 day aligner change. I'll talk more how we decide how many days the patient will need to change aligner. And again, with a lower incisor extraction, nice root parallelism, and nice intrusion, nice torque correction. So again, this is like a very quick way to correct a very complicated case and predictably. Another case is Genevieve, 25 years old. She has a severe canto of the lower arch. This is one of the victims I call a fixed retainer gone wrong. Like, unfortunately, she had a fixed retainer that got distorted the position of her teeth. So I'm not a big fan of fixed retainer. I just don't like to have the liability associated with something that I have placed and I can't monitor over time. So we usually, if we do have if the patient asks for a fixed retainer, I usually had a removable retainer to wear at nighttime, just in case something happened with that. But I prefer not to do fixed retainer anymore. But in this case, of course, there was a significant canto of the lower arch. So patient was again treated with Invisalign and orthopulse device. You can see the clean check setup, and these are a simulation of what we were hoping the teeth will end up, and this is exactly what we got. This patient was treated for 6 months with 22 upper aligner, 26 lower aligner with a 5 to 7 day aligner change. Another case where we did was an open bite case. She's 20 years old. So the treatment plan included some of the anterior extrusion, posterior intrusion, and level of the lower arch and alignment. Patient was finished in 6 months with 25 upper and lower aligner, 5 to 7 day change. She was better on wearing the aligner than cleaning her gums. So she probably eventually will benefit from grafting in the future. So Patel, she's 29 years old. She presented with severe crowding, with posterior anterior open bite, missing upper left permanent canine, and a still existing private canine on the left side. So he had some, of course, pretty severe amount of rotation for those lateral, and a pretty severe amount of open bite and Brody bite on the posterior. So there are a few elements of complexity in this case. The patient was treated with Invisalign in combination with orthopulse device, and we had to add some posterior elastic towards the end of the treatment to get the posterior teeth to kind of occlude in a better, get a better occlusion. So while we were going through the aligner, we implemented, added some up and down elastics. So we're really reactive. We just don't wait until the end of the aligner to do something. So if we see something is not quite happening, we immediately intervene, and that's the case where we intervene with different mechanic, with fixed appliances and rubber bands. So the patient was treated for 42 weeks, 45 upper, 47 lower aligner, and no additional refinement was necessary. And this is the before, and this is the after.